As in nearly every corner of the world, they're cleaning and disinfecting in Bangkok's densely populated low-income community of Klong Tue, doing everything they can to prevent the spread of COVID-19 from reaching their family and neighbors. Panya Silarap has spent all 56 years of his life in Klong Tue, most as a community leader and a volunteer fireman.
I am worried because we are in a crowded community with a lot of people living here. There are 594 households. I have to be worried. We need to make everyone understand how we should cohabitate, use face masks and stay indoors as much as possible.
The way disease outbreaks have impacted dense urban areas, like during the flu pandemic in the early 1900s, has played a role in how our cities look and run today.
The disease, in the way, threaten the city, in a way also shape the city and shape urban planning. So it gave the new standards, new knowledge, and new theory.
Urban planners reacted to that flu and other outbreaks, changing how cities were zoned and led to updated infrastructure, like ventilation and improved sanitation. But after what's been learned from pandemics and their influences on our skylines and way of life, we also need to keep pace and adapt. It's easy to assume that cities are fertile ground for spreading viruses and diseases, millions living, working, and commuting in such tight conditions. But one expert says it's about much more than just density. It's about how all this was put together and how it's run.
Density isn't the enemy here, to be very clear. And it would be sort of a fairly simplistic reading of saying density is the problem. It is much more about the design and the management of that density that is really the story here.
So for now, in those communities with few resources, a great deal of responsibility rests with people like Panya.
Everything we do to control and make sure there's safety in our community.
And hopefully at some point soon, community leaders and urban planners will take what was learned from the spread of the coronavirus and stop it from happening again, or at least slow it down during the next outbreak. Scott Heidler, Al Jazeera, Bangkok.